ఏపియాన్ పెయిన్ మేనేజ్మెంట్ సెంటర్. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
Shoulder pain, continuous nagging pain at the shoulder, having sleepless nights, you cannot sleep because your shoulder pain increases at night, unable to do your daily activities like brushing your hair, buttoning, unbuttoning your shirts, then my dear friends, you need to understand this is because of frozen shoulder and you need to get yourself checked. So I'm your Dr. Meenal Chandra, co-founder of EPN Pain Management Center. And let's talk about how can you get rid of shoulder pain. So frozen shoulder is nothing but a medical condition where the capsule which is present in the shoulder joint is thickened for some reason. The most common reason being injury because of rotator cuff or because of certain medical conditions like diabetes and thyroid, Parkinsonism, or you're recovering from stroke. So first thing you need to do is to go meet your doctor. They will identify the cause of your shoulder pain. Then they should do certain tests, active test and passive test, to identify which structure is damaged and what is the extent of damage. And then we do a ultrasound, that is a high resolution dynamic ultrasound scan, which has to be done by a trained doctor, so that we identify where is the problem, how much is the problem, what structures are involved. So once we do that, then you can get rid of the shoulder pain. It is very, very easy to treat with simple injection techniques. Because you must have tried a lot of over-the-counter drugs, you must have tried a lot of rehab and exercises, but you may not get accurate result. So getting these interventions like prolotherapy, like platelet-rich plasma therapy, these are simple injection techniques that is given into the joint under ultrasound guidance by a trained doctor, using certain kind of agents like platelet-rich plasma or mixture of local anesthesia and dextrose. These injections are done in operation theatre, and it will take around 15 to 20 minutes to do the injections. Patient is awake, patient is talking to us, done in a very minimally invasive way with no side effects in just 15 to 20 minutes. Post intervention, immediately the range of motion will increase, the pain will decrease, and the patient will be able to do those activities which he was not able to do now. But again, after this, there are certain lifestyle modifications and exercises which a patient should do to get the maximum result. So my dear friends, if you are suffering with frozen shoulder, make sure that you visit a proper doctor so that you get a solution, because this is absolutely 100% treatable and you will have no sleepless night if you choose to get these intervention done. Thank you.